My aim of presentation, why did I choose Vitreoretina? What is a realistic assessment of the present situation? I had a dream. I selected Vitreoretina. I'm a graduate and postgraduate of JIPMA Pondicherry, and I selected ophthalmology when I saw Dr. Badrinath operating in Shankar many years back and peeling off an epiretinal membrane from a patient from Dubai, and I was fascinated. It's just one of those situations which happens. So I was fascinated by VR surgery, and I was fascinated by the fact that I could see the entire eye, have total control on a diagnosis of any ophthalmology situation. So I wanted to be a complete surgeon. Diagnostic tools available, we can understand much better. We can surgically by doing the sutureless vitrectomy, and the eye looks much more the next day as what you get in a cataract surgery. So the results are much superior. But the main constitution for success is that you should have a passion for a branch, and you should have patience to achieve an excellence. This is true for all branches, whether it's vitreoretina, cataract, glaucoma, or orbit. In vitreoretina, the thing is you have to accept a long learning curve. You should train from a good institution. And what is important is not the fellowship, but post-fellowship, you should work in a busy center where you can hone your skills. Subsequently, you can decide the future course of what you want to be. The options available. I looked up the meaning of the word lance in dictionary, and lance means hunting. So basically, you are a freelance hunter of vitreoretina cases all over, or a government institution and a medical college. In the private institution, there are so many options available. I will not go through this because this is not the right forum, but you can have a charitable organization, a charitable private organization, and various other options that are available. What a private institution provides you is a good atmosphere of structured learning, options of being mentored, and a good working atmosphere. The problems that come up in such an atmosphere is that the work is demanding on a daily basis. You are scheduled to work from morning 7 to say evening 8 or 9 o'clock, and some people are not able to stay in such a structured atmosphere for too long. So what is the other option is to have a group practice, which may be a multi-subspeciality practice, or a multi-speciality practice, or a retina group practice. Ideal thing should be retina group practice, and not to be dependent on cataract surgeons to make us work with them. Ours is a group practice, but it is again dependent with a cataract surgeon. What does it take to set up a solo or a group practice? You have these things which have to be handled: the building and the infrastructure, the diagnostic equipment, the surgical setup, and a supportive setup of cataract and anesthesia. I will not go into the building and infrastructure because that is very personal. But yes, the cost is humongous. The cost is very exorbitant. If you want to have the complete diagnostic setup in today's situation, you require about this much money. That's about 85 lakhs to a crore to set up a diagnostic setup. And you want a surgical setup, almost a similar amount. So you require about 2.5 crores to set up a good vitreoretina setup. So this can be achieved only by going through a group practice, or you have to be extremely rich to do it. But it is possible in a group practice. In ideal situation, the cost of VR surgery is approximately, as I have distributed, is approximately, ideally if you use all disposable equipment, is so much as about 80,000. But the range which we charge all over the country varies from about 10,000 to a lakh. Because we use numerous cost-cutting measures. These cost-cutting measures are not that they reduce the quality, but in our Indian situations, we have realized methodologies of using certain cost-cutting measures. So, must be understood. The specialty is very paying. It's very satisfying. The results are quite satisfying these days. The VR surgeon may not get a job immediately. The initial starting salary for a VR surgeon is much higher than a phacosurgeon. Though later on the phacosurgeon catch up and go ahead of us. We have to change this situation. That is the way to go. Join hands, make vitreoretina as the most sought after profession. I should hobby, and because it is my passion, I should be doing it as to be monetized. Thank you very much.